Cambridge Urology Department is based at the Cambridge University Hospitals, formerly known as Addenbrooke's Hospital. And within our campus, we've also got the world-renowned Cancer Research UK Cambridge Institute, as well as the MRC Laboratory of Molecular Biology, as well as our links obviously with the University of Cambridge locally. Cambridge Urology has been around for some time, serving the local population. We also attract patients here from other areas nationally as well as internationally because of our comprehensive cancer management we offer, particularly for prostate cancer. We have a team of 16 colleagues which has grown substantially over the last decade, each with their own subspecialty area. And we are a very cohesive department, and everyone is focused to ensure that we deliver the best possible care, but also maintaining not only patient safety but efficiency as well. We also have multidisciplinary team working which is well established, and the idea and ethos behind that is always making sure that patients get the most up-to-date treatment which is appropriate for their medical condition. Our department has close links with the Cancer Research UK with the prostate cancer research that, for example, David Neal's lab's been doing over the last decade.
Back in 2005, the University of Cambridge and Cancer Research UK, helped by a generous donation from Li Ka-shing, set up this institute, which was meant to be a translational cancer institute and covers a number of cancer types actually. If we just look at prostate cancer research, we'll be able to improve three things. Firstly, our method of diagnosis. Secondly, our ability to predict future behaviour so we can target treatments. And thirdly, to improve the treatment of men with the highest risk of prostate cancer.
More recently, we've been looking at improving the diagnostics aspect of prostate cancer, looking at image-guided prostate biopsies. Colleagues have been working with both University of Cambridge as well as international universities to look at combining MRI with ultrasound to help focus and target better for prostate cancer, combining the two imaging modalities.
Addenbrooke's Hospital and Cambridge is nationally leading in outcomes for diagnostics and treatment for prostate cancer. We've achieved this to the highest quality with detection rates in positive MRIs of over 80%. We've chosen the transperineal over the transrectal approach to the prostate to improve safety for the patients and reduce risks of infection and sepsis. Using state-of-the-art validated fusion technology, we are able to provide accuracy and certainty for our patients.
We introduced robotic radical prostatectomy back in 2005. We're one of the first centres to develop this in the UK. Since then, we've undertaken some 1,400 procedures to date and undertake some over 200 procedures annually, which makes us one of the large volume centres in the UK.
Working in an integrated practice unit, we are able to provide prostate brachytherapy together with our oncologists. We use high-level technology and software to plan the procedure in an inverse fashion, and automated seat delivery ensures accurate placement.
We have 3 colleagues who undertake bladder cancer management, including radical cystectomy, and in fact we're one of the high volume centres in the UK to deliver this, and they've combined that with enhanced recovery program to reduce the length of stay and also keep very low mortality rates for this fairly morbid procedure.
We have the opportunity to offer a full range of urinary diversion techniques, from the simpler with formation of a urinary stoma, all the way through to the more complex with use of catheterizable reservoirs or orthotopic bladder substitutes. The fact that we undertake cystectomy on a regular basis is reflected in our outcomes, and we have a competitive mortality rate at this hospital of less than 1%.
It was in October 2010 that I noticed blood in my urine, and it was diagnosed as high-risk non-muscle invasive bladder cancer. I was offered a choice of 3 procedures, and I chose, I think it's called an ileal orthotopic bladder substitution. So Mr. Turner built me a very nice new bladder out of 1/2 metre of my small intestine, and that was 3 years ago, and I've been fine ever since.
Our laser surgeons are not only delivering a very high volume of laser surgery and involved with training both nationally and internationally, but they're also involved with industry to improve the quality of laser both for enucleation and vaporization techniques. Here in Cambridge, we are the regional training centre for East Anglia to train future urology surgeons.
The great thing about training here in Cambridge is the range of subspecialist training opportunities that trainees will have from the point of view of surgical skills, but also the huge range of academia and academic projects that are available to them.
Looking into the future, we want to be part of the growing biomedical campus on site to ensure that we improve patient care through enhanced education, training and research opportunities.
I'm just one of Addenbrook's many thousands of grateful patients. I had my operation 3 years ago when I was chairman of the hospital, and it's the excellence, the safety and the kindness of the urology department that brings patients like me back to Addenbrooks.